your eyes on me.
And it is the most severe erythema. I most severe forms of erythema multiforme. Then it is due to use of this is due to the reaction of medications, mga antibiotics, especially sulfonamide, then anti-seizure agents and NSAID drugs. Wow,
I like this. I like that.
NSAIDs, wow.
the clinical manifestations
Yeah,
are
how did it start?
start.
Patient.
Erythema ma'am first. Kanang red.
So like, for example, the patient, so I'm drinking this medicine, and then after that, what will happen?
Kanang history ma'am, if you are drinking kanang using antibiotics previously ma'am, then ang reaction mauna, then
It will start as itchiness, either itchiness like that, erythema, okay.
erythema first, then itchiness, then it is also included in the conjunctival
Table sack.
Listening to her makes me sick. No, I mean with the clinical manifestations. Okay, and
Then in the oral mucosa, it also lesion also appears. Then in the skin yun, erythema, then burning sensation, and patient also experience fever.
there are a lot actually. Genitalia, involvement of the larynx, bronchi. So we can expect that the voice of the patient is also affected. So parang and then fingernails, toenails, eyebrows, and eyelashes may be shed along with the surrounding epidermis. So there will be scaling of the skin. So how many weeks or months would it? The patient should have this. Well, ina sila balak sila konten flowers, but you haven't read about it. So what is the complication?
Complications include disease and keratoconjunctivitis, septic because of the blisters, presence of blisters. So the patient we have to kanang culture sensitivity if what microorganism is present. Then keratoconjunctivitis. So the nursing intervention should include eye lubricant
Nice one.
and eye patch.
Kanina yung mga disturbances na rin.
Then the risk factors are it occurs in any ages and genders, female or male ba. Then increased incidence to older persons because of the use of medication previous. Then to those immunocompromised patients, those who has HIV/AIDS, and also for those cancer patients and organ transplants.
Planning.
Oh my God, planning. Planning is to
My God,
prevention of
Yan ito nung tapo na kurota ng
prevention of
Oh my God, my God, na rin po na.
maintaining so within electrolyte
Electrolyte.
Oh my God.
Kitawa po si Brent. My God, Brent. My God, wala kay Brent.
Prevention of hypothermia.
My God.
So in your nursing intervention, you have said here that you have to maintain skin and mucous membrane integrity. Give us some of the subtopics in maintaining skin integrity. Your nursing intervention for that.
Careful.
Okay, sige. Let's narrow it down. Placing the patient in a circular turning frame every 2 hours. What is the rationale?
Patients are
This is just a rationale here.
Wow.
patient is being placed in a circular turning frame every 2 hours. So, like this, like that.
Every kanang one this patient or turn patients every 2 hours.
Why?
Because their patients are prone of easily yung sa natawag.
Mapaklit ilang
mapaklit ang pari.
Denuded. The skin are really denuded.
And there are also, if patient is
No, not pressure sores. In Stephen Johnson disease, they are already scaling of skin. So if matagal yan nakaano on that side, di ba? There are tendencies na ano siya sa cloth.
Yes.
That's why we also give petroleum jelly or any topical ointment. How about, what is the rationale of giving careful oral hygiene?
careful oral hygiene.
Yeah.
Since the patient is having lesion, so we need to be oral secondary to prevent secondary complication like infection.
Okay. We prevent also hypothermia. Why?
So because patients are prone
Prone.
hypothermia related to sa denuded of the skin, ang secondary to skin loss.
Yes.
So patient bite na bata should
Idol.
temperature. Bite na bata mo mga preventive measures mo like heat lamp, katong blanket.
How do you reduce or how do you prevent dehydration to your patient?
So I think fluid is necessary now. And yung in GP
In that case, what do you give? An isotonic or a hypertonic?
Hypertonic.
Or hypotonic?
Wala ko nakita ang sabong mga
But in your analysis,
isotonic mo.
why?
Because parehas sila sa fluid sa body.
And then,
Then,
your burn patients, what you will do?
ID, MR ma'am, MR, needed rangers.
Why?
Okay, kuan.
Hindi akong Power Ranger. Why?
D5.
LR is a hypertonic. So in Stephen Johnson,
Hypotonic, so ang cell kay
Nag-swell.
oh, so sige,
hypotonic lang.
sa akong Stephen Johnson.
Sige, kung mga hypotonic na ko.
Wala man sa tingin.
Wala di, sa pagkaan
Mga plain good, plain.
NaCl.
Sodium.
Hypotonic.
Hypothermia.
No, what I mean is kung na-Stephen Johnson, diba grabe man din ang pagkuhan sa mga panit. Ano, mula ganito na i-burn, di ba, and everything.
Hypertonic po siguro.
Either give hypertonic or iso.
Hyper ice.
Okay. How about lessening the anxiety? How will you lessen?
Listen. Ano ba?
Encourage the patient
Lessen.
feelings, of course. And parang mga kabalitan o
Oh? Really? Mga disturbances kayo.
So here, there is replacement, administration of IV immunoglobulin. Okay. Why? Because it is a treatment of choice and the drug of choice, diba? Yes, ma'am. The administration of IV immunoglobulin to what? Exactly. Skin healing. Okay. Next diagnosis. Ika lang, ayoko na ng body image disturbance, ayoko na ng impaired skin integrity. Ano pa iba? Fluid volume.
Fluid volume deficit.
Wala naman sa nanda na hindi mo nila. Okay. Okay, call Araral. Samuel, stand well. You need to sit down. Sit down muna. I need to ask you something.
Code 6666. Samuel Araral.
Psoriasis, right? Psoriasis. Ay, cirrhosis.
Speak in English. We're not accepting Visayan word here.
So English.
Yeah, I cannot understand what you're trying to say.
So what? Do you want to defend this, or you want me to add some more journals?
Add them journal.
Defend.
Why? Ma'am, he did not write.
Or we will add more journals. But actually, I will still add another journal. Because you didn't have
But you don't have you don't have oral grade if you don't defend your
You have the same question.
Yes. So defend.
Meaning you're meant to be.
Sige, this time, or just tell us about this muna. It is also a dermal problem, so no problem.
Cirrhosis is the
Cirrhosis naman din mo.
cirrhosis rin siya right. It is the ability ng the loss of water in the skin dahil ang moisturizer niya cirrhosis siya.
Dryness.
Gitawag siya senile kay senile is elder, di ba? Then hormone siya sa elder.
Well, di bang elders?
Degeneration.
Yes.
Ano siya, mag-dry ng skin.
Yes.
Kaya gitawag senile cirrhosis.
Ang elder nila ba prone dehydration?
Pero kanang cirrhosis, pwede siya pwede siya sa mga
So,
biscuit
there's
sa
a inflamed
mga skin diseases,
Yes.
Ma'am, very problem. Desire, ma'am.
pero mas common siya sa elderly. Ano ito siya senile cirrhosis.
Yes, okay.
What else?
Some,
What are the particular factors? That is, we did study this one talaga.
This was in factor. Environment.
Environment? What kind of environment?
Unit.
How about your intervention?
Dilation.
That is a medical treatment. So how about your health issues? You are basically
Speak in English.
what kind of in medical
there's a dog show here, dog.
ayoko na kitang pahirapan, no?
More.
I'll be giving some instructions.
More, ma'am, more. More journal.
Everybody's done now.
More journal.
Back to your post first.
More journal.
Bayot na Dapat tayo Wednesday, wala week.
Yes, we have a journal on Wednesday about skin problems and diabetes. Or diabetes. Isa lang. So, yun yung requirement natin sa ano.
Journal?
Yeah.